In this video, I'll be briefly discussing 12 common disorders of the gastrointestinal tract that have a diet-related intervention strategy to help patients ease their symptoms or are affected by the choices we make in selecting food for consumption. Let's get things started with ulcers. This is where the protective lining of the stomach or duodenum has been eroded and left vulnerable to chemicals like stomach acid. The primary cause? Helicobacter pylori, an insidious bacterium that can wreak havoc on the human body and make us miserable. What can we do from a nutritional standpoint? Avoiding caffeinated beverages like coffee and sodas, abstaining from alcohol, as well as any other disagreeable food items until the ulcer has healed. Aside from medications, reducing our stress levels and the cessation of smoking go a long way in making our symptoms better. Gastroesophageal reflux disease, or GERD for short, is characterized by stomach acid backing up into the esophagus because of a weakened lower esophageal sphincter. That's the valve that is normally able to keep partially digested food confined to the stomach. Remember that the stomach has a protective lining to prevent cell damage. When stomach acid backs up into the unprotected esophagus, this causes the uncomfortable and often painful sensation of heartburn. What can we do from a nutritional standpoint? It's the usual suspects, of course: reduce our intake of caffeinated coffee, avoidance of alcohol, and not eating anything with peppermints after eating a meal. These food items relax the lower esophageal sphincter, which allows stomach acid to back up into the esophagus and cause heartburn. In addition, refraining from nicotine also goes a long way in relieving symptoms. Additional tips including eating smaller meals, drinking liquid between meals, wearing clothing that are not restrictive around the abdomen, keeping yourself upright, waiting at least 2 hours before a planned exercise, and losing weight if necessary. These all help keep the stomach contents where they belong, in the stomach. Gallstones are crystallized deposits consisting mostly of cholesterol that can block the cystic and/or common bile ducts. This prevents bile from flowing into the duodenum, which subsequently hinders the digestion of dietary fat. What can we do from a nutritional standpoint? Well, there aren't any specific foods that increase the risk of gallstones. However, being obese does increase a person's risk because of an increase in cholesterol synthesis. It goes without saying that weight loss is recommended. However, rapid weight loss in about 25% of obese persons also increases the risk of gallstones. So, slow and steady weight loss is a preventative tactic. Are you lactose intolerant? You're in the majority. About 70% of the people in the world are intolerant to lactose. The reason for this is because most people lack the enzyme lactase to be able to digest lactose. The presence of lactose in the GI tract in a person with lactose intolerance leads to symptoms such as bloating, flatulence, and diarrhea. What can we do from a nutritional standpoint to mitigate these symptoms while still enjoying the foods we love? Individuals can try to limit their consumption of food items that contain lactose, consume products that have been processed to remove lactose, like Lactaid, use Lactaid drops, which contain lactase in food items the person wants to consume, and experiment with fermented products such as yogurt or kefir. Constipation is a problem where the colon has removed an excessive amount of water from stool, which subsequently leads to uncomfortable and possibly painful bowel movements. There are so many reasons that can lead us humans to becoming constipated. From a nutritional standpoint, what can we do? Staying properly hydrated is at the top of the list, followed by a high-fiber diet. Other non-nutritional tactics include not ignoring the signals that you need to go, number 2. Also, regular exercise helps keep us regular. In the short term, you could also try increasing the fat content of the diet to stimulate bile salts, which pulls water into the gastrointestinal tract. Some may find that honey may do the trick as well. Hemorrhoids, also known as piles, are a royal pain in the anal triangle. Maybe the gluteus maximus as well. Essentially, the discomfort comes from veins in the rectum and anus becoming swollen owing to straining during defecation or from the increased intra-abdominal forces of labor during the birthing process. From a nutritional standpoint, what can we do? Our best defense is consuming food items that help soften our stool, like drinking plenty of water and consuming a high-fiber diet. Also, let's not forget about regular exercise, helping to keep us regular. Diarrhea is a problem where the colon has not removed sufficient water from stool, hence bowel movements become loose or watery. There are so many reasons that can lead us humans to experiencing diarrhea. What can we do from a nutritional standpoint? While there is no preventative dietary regimen when diarrhea occurs, it's important to stay well hydrated and ensure adequate electrolyte intake, primarily sodium and potassium. It is also helpful to allow the bowels sufficient rest by consuming less food, choosing low-fiber foods, and avoiding lactose. Celiac disease, also known as non-tropical sprue, is an autoimmune disease that causes inflammation and subsequent destruction of gastrointestinal villi. This leads to the malabsorption of nutrients. The culprit of the immune response? The consumption of gluten, a protein found in a variety of grains such as wheat, rye, oats, barley, bran, gram, or malt that triggers the immune system to attack. What can we do from a nutritional standpoint? Elimination of all gluten-containing foods. Thankfully, the food industry has responded with a variety of products to help those affected by this disease. This may leave you wondering how celiac disease is different from a gluten sensitivity. Well, this is a relatively new area of research where we still need to collect more data to better differentiate between these disorders. Gluten sensitivity, officially named non-celiac gluten sensitivity, shares similar intestinal symptoms with celiac disease. However, there are also other symptoms outside of the intestinal tract for reasons unknown to scientists. At the present time, avoiding the gluten-containing products is the best nutritional advice we have to offer afflicted individuals. Diverticulosis is a disorder where small outpouches form along the walls of the colon. As fecal material moves along the gastrointestinal tract, stool particulates can become trapped in the diverticula. The prolonged presence of fecal material in these small pouches can result in inflammation known as diverticulitis. What can we do from a nutritional standpoint? A common recommendation is to consume a diet high in fiber to prevent the development of diverticula, as well as helping to reduce the risk for diverticulitis. Yet another win for a high-fiber diet! Inflammatory bowel disease includes two types: regional enteritis, known as Crohn's disease, and chronic ulcerative colitis. In Crohn's disease, it is common for the ileum portion of the small intestine to be the target of the immune system in response to an unknown trigger like a virus or bacterium. What can we do nutritionally for people with Crohn's disease? Attempting to identify problematic foods by eliminating them from the diet and slowly reintroducing that food is a start. Some individuals respond to low-fiber and lactose-free diets, but each individual may respond differently, making it challenging for generalized recommendations. Preventing malnutrition and weight maintenance are also important considerations in the management of this disease. In chronic ulcerative colitis, the inflammation is confined to the rectum and colon. What can we do from a nutritional standpoint? For the most part, the individual's diet doesn't need to change that much. The most important strategy is to replace lost nutrients such as electrolytes and water and correct any deficiencies owing to flare-ups. During severe episodes of inflammation, restricting food may be advised along with parenteral nutrition. Irritable bowel syndrome, or IBS, leads to a variety of symptoms such as abdominal cramping, bloating, constipation, or diarrhea. While the cause of IBS is idiopathic, it is believed that individuals suffering from this disorder have a hypersensitivity to certain food items such as caffeinated beverages, chocolate, oh no, not chocolate, alcohol, dairy products, wheat, or even a large meal. What can we do from a nutritional standpoint? Identifying problematic foods and reducing their intake is a good approach, as well as slowly increasing a person's fiber intake and ensuring adequate hydration. Other individuals may respond to a reduction in the consumption of fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, collectively known as FODMAP. Some individuals may respond to strategies such as participating in a structured and regular exercise program that helps reduce their stress levels and thus help mitigate IBS symptoms. Food allergies occur when an individual's immune system mistakenly attacks the offending food item. In general, the protein portion of the food item is typically the trigger for the immune response. The most common offending food items are milk, eggs, fish such as bass, flounder, and cod, crustacean shellfish like crab, lobster, and shrimp, tree nuts such as almonds, walnuts, and pecans, peanuts, wheat, soybeans, and sesame. But there is growing evidence that other food items can be problematic as well. What can we do from a nutritional standpoint? Identifying the trigger food item and eliminating that item from an individual's diet is currently the only solution to this problem. It is important to note that food allergies elicit an immune-mediated response, while food sensitivities do not. In summary, we've reviewed some common disorders of the gastrointestinal tract and some of the basic nutrition strategies associated with reducing the risk of occurrence or helping to mitigate symptoms. One of the most important points to remember is that each person should be evaluated and treated based upon an individualized plan to maximize the effectiveness of the treatment strategy. Thanks for watching. Have a healthy and productive day.